According to InfoFreeze, mortality rates for cancer as of the 1900s were low. There were only 64 cancer-caused deaths per 100,000 people. As of 2011, there are 184.6 cancer-caused deaths per 100,000 people. The price of treatment has gone up to $100,000 per patient per year. While medical professionals continue to search for a cure, large players in the medical and pharmaceutical industry have alternative motives to thrive as a business industry and profit. The pharmaceutical market is worth $300 billion with an expected rise to $400 billion next year. The often natural and inexpensive methods of treating cancer threaten the capital generated by the three majorly accepted treatment methods: surgery, radiation, and chemotherapy, two of which are carcinogenic. Any alternative treatments of cancer are completely ignored and do not undergo FDA tests. Big Pharma, the nickname given to large pharmaceutical companies, is suppressing alternative cancer treatments in order to make $400 billion. Due to the large increase in cancer-related deaths, the medical industry and pharmaceutical companies began to emphasize the treatment of cancer during the late 20th century.
The early 1900s brought the immersion of pharmaceutical drugs which had the potential to be very profitable. The American Medical Association transformed pharmaceuticals into an industry. G. Edward Griffin, author of A World Without Cancer, wrote that the takeover of the medical industry was accomplished through the takeover of the medical schools. Carnegie, Morgan, and Rockefeller gave massive grants of money to medical universities and proposed that the schools allow representatives of the donors to sit on the school's board of directors. These three billionaires were huge supporters of radiation, surgery, and the use of synthetic drugs. The method by which doctors receive their education has effectively been taken over by proponents of business. Doctors prescribe drugs and are limited in their acceptance of alternative treatments because that is how they were taught. John Abramson, MD, describes how in the 1990s, most of the clinical research was pulled out of the National Institute of Health and was then conducted by profit research organizations. This gave complete control of research of diseases to drug companies, allowing them to create studies and control data. These powers enabled the drug companies to withhold the researcher's data from the public.
Natural materials and treatments are illegal to patent. This disables companies from gaining a monopoly on a particular substance that might be used to treat cancer, such as vitamin B12 or THC. In studies conducted by Philip and Zella, the B12 vitamin has been found to drastically reduce tumor size and slow the metastatic process. Researchers, less interested in profit, criticize large pharmaceutical companies for refusing to acknowledge or educate the public on the B12 vitamin. Despite professional medical suggestions to utilize B12, Big Pharma continues to reject links between B12 and cancer. The Medical College of Virginia in 1974 was tasked to find evidence that smoking cannabis, or THC, damages the immune system. When they tested the effects on mice, they found instead that cannabis is an ideal medication for reducing tumors, both malignant and benign. The DEA, part of the FDA, responded by immediately shutting down the facility, and all medical research was halted. The Medical College of Virginia applied to receive grants for further research in both 1996 and 2006, both times being denied by the DEA. A similar study done in 2000 by Manuel Guzman in Madrid, Spain, also led to similar results. 19 out of 15 rats injected lived significantly longer than those without it, and 3 rats were completely cured.
The medical field cannot be forced to accept all natural treatments to cancer or other diseases, 1, because they most likely do not all work, and 2, because ultimately the doctor's choice as to what methods are used to treat a patient, as long as the option is approved by the FDA. But the FDA is not willing to expend the money required to test a substance that would result in a massive loss of profit for their partners in the pharmaceutical business. However, if a private lab can conduct tests on a substance to determine its ethicality and effectiveness, like the FDA does, then this substance could be readily available to patients who choose to attend alternative cancer treatment clinics. This testing by private labs is a solution to the problem of the suppression of possible cancer cures. It will disallow the FDA from deeming natural cures virtually illegal. However, these other research facilities would often be subject to scrutiny. This could be remedied with peer reviews conducted by other medical research organizations. If medical professionals deem that the studies tested, if their study is accurate in testing methods, then the results should be considered with the same amount of reliability as the FDA. This would result in the ability for the medical industry to function primarily for the purpose of helping those individuals who need the assistance so dearly. Thank you.
Let's start with Maria. Maria, what did you decide to leave out of your presentation when you were going through? Because since you had 4 people in your group, I would assume you had a lot of information.
In our research papers, we had kind of discussions about individual doctors that have already been trying, like, leading facilities and trying to, and getting patients and successfully curing them. So, but we decided to leave that out of the actual presentation because of time reasons.
Okay. Let's go with Kieran. You had a big team, 4 people, so talk to me a little bit about how you guys decided to set up the strategies for, splitting up your research and the presentation and how that worked out.
We ended up deciding that Bria would do mainly research, and then Shane would do mainly the writing, and then me and Ellen would do mainly the presentation, like the PowerPoint. And I think we decided to do that because we realized that we can kind of all help write and do research, so we only really needed one person for each of those. But then for the PowerPoint, it just takes a little bit more time in deciding, like actually making something and putting it together, so we decided to have 2 people to work for that.
Okay. Ellen, if you were to sum up your team's solution in 1 sentence, I didn't give it to you this time. Could you do that for me?
Yes.
Maybe.
Our solution is to use private labs to enforce the new treatments that are being proposed by private doctors.
Okay. And Shane, lastly, as you were doing research, I would assume that since you guys had this topic, which was maybe harder to find some information on, tell me about what information you were looking for that you had a hard time finding, and how did you confront that?
Well, definitely, it was hard because, all of the things that you would typically think as, credible sources, you would have to consider the bias of that, well, maybe, they're just saying this because, they're backed by, large pharmaceutical companies. So, you just kind of have to look for data that you trust that is not necessarily from these big businesses, and that comes from people that are, I guess, gone rogue in medical industry, who used to be doctors and are, medically trained, but then have conducted this own research by themselves. So that's kind of what we look for.
Okay. Nice job.